One of the options for individuals with rotator cuff tears, particularly ones who've exhausted things like physical therapy and injections, is to actually perform a rotator cuff repair. It's one of the more common procedures that I perform in my practice. There's a lot of, I think, misunderstanding and misinformation in regards to what people go through during a rotator cuff repair. There's a lot of anxiety people have about the level of pain that they're going to have, but ultimately what we do when we repair the rotator cuff is we're actually trying to take the tendon that's torn and actually pull that tendon back down to the bone exactly where it belonged anatomically. That's done most commonly in my practice arthroscopically or minimally invasively through small incisions and utilizing a camera and video equipment to allow us to get into the shoulder and see the tear without making a large incision to get to it. That allows for potentially less scarring, potentially a faster recovery, but ultimately patients do take on the neighborhood of 3 to 6 months to fully get over a rotator cuff tear after having it repaired. And there's been extensive study in the literature on this, and most people would agree that about 90 to 95% of patients have what I would call a satisfactory result after a rotator cuff